I get the sense that Pennsylvania is a little bit different. You mentioned earlier this subsidy for personal care homes and for housing. Pennsylvania differs from some other states, right, in an important way. So maybe could you talk a little bit about that, and from a public policy perspective, maybe what your wish list might be in terms of what could really help move this forward in a significant way?
Well, Pennsylvania has made some significant gains, I think, in the last several years in rebalancing their long-term care system. And so we are seeing a decrease in the nursing home population. We're seeing an increase in home and community-based services, which are the waiver programs that support low-income individuals that have the clinical needs. One of the things that we've not done in Pennsylvania is we have not allowed for waiver or home and community-based services to be used in assisted living facilities. And we're one of 3 states nationally that has not moved to incorporating those services so that people in assisted living could actually remain there, have affordable care brought in, and be able to age in place without transitioning to a nursing facility. So I think that's an important difference. I think Pennsylvania has also made an attempt at supporting the low-income personal care home population. And years ago, when I was first in the business, it was probably an adequate attempt. But there's not been an increase in that rate in more than 10 years. And so what's happened is we've lost 80% of the low-income personal care home beds in the state. And combination of those 2 factors, the low reimbursement rate for the low-income beds and the unavailability of waiver services in assisted living, I think, are both contributing to a decline in personal care homes and personal care home beds statewide at all levels. We simply are building facilities to provide care for people who can only afford that care for a very short amount of time. And then we're seeing a transition to nursing facility, which doesn't have to happen.
It doesn't have to happen, and there's also a higher cost burden because oftentimes we know that individuals end up becoming state supported sometime during their stay in a long-term care facility. So it really is helping. Our need is to help the state realize, that cost burden is pretty significant, and the ability to support low-income options for care and aging in place is also very much needed.
So I have 4 things on my wish list.
Yes.
I wish that the personal care home supplement would increase to what we find a livable rate is minimally at $75 a day from $36.30. The second is that we do permit assisted living facilities to be able to utilize home and community-based services for individuals who are clinically and financially eligible. The third is that we actually build a demonstration project, which we're working on here in New York, that would allow people of different means and different abilities to live in a community-like setting that allows them to transition between levels of care as needed and really does provide I'd love to build something here that could be replicated. So as Penn State researched all those programs out there for us, I'd like us to be one of those programs that gets researched for the next community. And lastly, I wish that all communities could come together to support facilities and providers and community initiatives that really do support this population and find ways, not everything is entirely about money, and some of it's about how communities can come together and make things happen. And so, those would be my 4 things.
That's all, huh? In terms of making progress on those 4 things, I mean, so lots of awareness and participation, as you mentioned, the marketing firm who can provide some awareness through advertising and maybe some drug assistance programs. But it also seems like our elected representatives at the state level who serve communities are probably critical. Are you finding, as you talk about these 4 things, what level of receptiveness is there both in your community and it sounds like you're dialoguing with others across the state in their communities who are having similar issues as well?
Yes. Well, we're not, we're adding our voice to the collective, and in some ways there are others leading the initiative around assisted living facilities and waiver services. So we're adding our voice to that, but we're not the driver. In other cases where we're looking for an increase to the personal care home rate, we're probably more of a driver in that process. We've developed some legislative tools, and we're starting a campaign in December and January, actually, where we have begun to reach out to legislators and begin our ask for the next budget year. And in terms of community, we're still working with partners to develop a local project here.
Got it. But are you finding that some legislators are interested in this topic? I mean, they understand it.
Well, you know what? I think it's when you talk about the numbers and when you talk about the daily rate, I think there has to be some shame in that, and so we'll use that because it is shameful, I think. But there's also, it's a budget issue, and there's I don't know if Pennsylvania owns the term woodwork, but it's used frequently there about what would the woodwork effect be if we increase this rate and what's it going to cost. And you can demonstrate on an individual basis what that savings might be related to compared to the cost of the nursing facility and the medical assistance costs there. But you really can't accurately predict the numbers of people out there that may move into the program to take advantage of if the rate goes up, we may have more facilities willing to take people and keep them at that rate. And so the question is always, what's the woodwork effect? But yes, I think, we've had some positive response. We're joining voices with the state ombudsman. We've had state meetings on this, and we're adding to our partner list for support. So I'm always an optimist, and I think, we are going to have a good 6 months ahead of us for advocacy.
Yeah.